Assalamu alaikum. My name is Sameen Azhar and I'm a PhD scholar. I'm working as a lecturer at University Institute of Diet and Nutritional Sciences at the University of Lahore. The purpose of making this video is to record a lecture on the topic nutrition care process. Nutrition care process is one of the most important and fundamental topic of the field food and nutrition. Following are the objectives of this lecture. Of course, it is going to cover what is nutrition care process, and it is going to talk about the 4 steps that make up this process in detail. Before I go on to each step of nutrition care process and talk about it, I would like to briefly explain what this process is all about. In simpler words, whenever a person, a client, or a patient approaches a nutrition care professional to seek certain kind of guidance or to seek help regarding a nutritional process, whatever the nutrition care professional does in response is basically the nutrition care process. Any individual could approach a nutrition care professional regarding their unhealthy eating practices, maybe regarding some sort of nutrient deficiency that they're suspecting, maybe iron deficiency. They can approach a nutrition care professional in regards to weight loss, weight management, anything. And whatever in response a nutrition care professional does to help them, to facilitate them, is basically nutrition care process in simpler words. It is an organized and systematic process that is comprising of 4 steps: nutritional assessment, nutritional diagnosis, nutritional intervention, and nutritional monitoring and evaluation. We are going to go on to the first step, which is nutritional assessment. But before that, we need to talk about nutritional screening. Nutritional screening is the prerequisite to nutritional assessment, which is the first step of nutrition care process. Nutritional screening is to find out individuals who are at risk of malnutrition. There are several universally accepted and validated tools for that: subjective global assessment, SGA, mini nutritional assessment, MNA, malnutrition universal screening tool, MUST, MST, malnutrition screening tool. All these are the screening tools that are going to help nutrition care professionals to find out those individuals in any community or at any place where there are a group of people, just to find out those individuals who are at risk of malnutrition. Why do we do nutritional screening? To save our time and to prioritize those people who are in greater need of nutritional assessment. Rather than going into the detailed process of nutritional assessment for any person, first we would like to find out that whether they are at risk of malnutrition or not. Why? Because nutritional assessment is a detailed process, and it is not only consuming time, but a lot of energy as well. Nutritional assessment, which is the first step of nutrition care process, is a comprehensive evaluation that is carried out by a registered dietitian. And that registered dietitian is basically going to collect all information that he or she needs to make a nutritional diagnosis regarding the person, patient, individual, or client that has just approached them to seek help, to seek guidance regarding their nutritional status. What sort of information the nutrition care professional will gather in nutritional assessment? They're going to take information regarding their medical, social, nutritional, and medication history. They're going to talk about their dietary data, like what kind of dietary intake you have been taking, what do you consume generally in the whole day, and also they are going to make a clinical and physical examination on the basis of how that person actually looks, their physical features, and why are they actually observing them? They're observing them to get any sort of clue regarding their nutritional problem. So this nutritional assessment is going to help the nutrition care professional in reaching to the point where they can say that this is the problem that this person has seen me today. This nutritional assessment is going to define the nutritional status of the individual who has approached them by finding out their medical, nutritional, social histories, and by making physical examination, that is observing the person, and by also taking their lab test or their biochemical data where it is required. Nutritional assessment is a comprehensive evaluation carried out by a registered dietitian for defining nutritional status using medical, social, nutritional, and medication histories, physical examination, anthropometric measurements, and laboratory data. What is the purpose of doing it? The purpose of doing this rigorous process and making this thorough assessment is to find out or to reach the problem that that person has approached you for. Sometimes people would come to a nutrition care professional and they will right away tell you that this is the problem that we are here for. But sometimes to be sure and sometimes to reach to the problem, we need to work quite hard in nutritional assessment so that we can give a diagnostic statement about it. Nutritional status that we are working on in the nutritional assessment is basically the state of body or the status of body in terms of nourishment of that individual. Nutritional status is basically built in any person by two factors, internal and external factors. Internal factors that affect the nutritional status are going to be the factors which are within the person. For example, their age, their gender, in general, their behavior, their choices, their likes, their dislikes regarding food, their physical activity level, and maybe if there's certain kind of disease, the state of disease. External factors include how safe food they are consuming, what are the circumstances they are living in, what is their socioeconomic status, what culture they belong to. Collectively, internal and external factors give a product which is known as nutritional status. How can this first step of nutrition care process be done? Nutritional assessment. It has two methods, direct method and indirect method. Direct method involves the person directly who's being assessed, and that person is assessed by all the means that we have talked about in the discussion of nutritional assessment. That was anthropometry, biochemical data, physical examination, histories regarding their medical status and their nutritional status. Whereas indirect method takes vital statistics or community indices or community data to interpret the nutritional status or the condition of the nutrition state in any community or group of people. It is an indirect method of assessing nutritional status. So there are two methods of nutritional assessment, direct and indirect. The direct method, to be specific, has 4 steps: anthropometry, biochemical evaluation, clinical examination, and dietary data. Anthropometry, to be precise, refers to the physical bodily measurements that include the height of the person or the patient who has come to the nutrition care professional, their weight, their mid-arm circumference, their body mass index, and all relevant physical bodily measurements. Biochemical evaluation. Biochemical evaluation, as the term suggests, refers to the laboratory test, laboratory data to find evidence regarding the diagnosis that you would make. If you're suspecting an iron deficiency, anemia in an individual, and all the signs and symptoms, all the clues are hitting right at iron deficiency anemia, you would still need to go for a lab test and verify it after having their lab report regarding the blood view. So biochemical evaluation is also a part of nutritional assessment. After anthropometry and biochemical evaluation comes clinical examination. Clinical examination is also known as physical examination, because in this, the professional, the nutrition care professional is going to physically examine the individual if they have any sort of sign and symptom of any deficiency of a nutrient, or maybe anything that can give the professional a clue to find out that what kind of nutritional problem this individual is suffering from. So far we have talked about 3 things in nutritional assessment: anthropometry, biochemical evaluation, and clinical examination. Anthropometry was to get the physical bodily measurements of the person. Biochemical evaluation was to get the lab test, and clinical examination or physical examination was to assess the person physically if we can find some sort of sign and symptom or maybe some clue to reach to their nutritional problem. The last step, although it's not mandatory to do it at the last, you can rearrange the steps of the nutritional assessment. Dietary data or assessment of dietary intake includes information regarding what that person has been eating. What is their dietary routine, what kind of foods they prefer, how much they eat, how they eat, what kind of choices they make. And to collect this dietary data in nutritional assessment, we have several methods, including 24-hour recall, usual intake, which is like what you usually consume, 24-hour recall is that what you have consumed in the past 24 hours. Food frequency questionnaire is that you offer them a list of foods and you ask them how frequently these foods you have been consuming. And there are 3 more methods to it. We won't be going into the detail of each method because we have to cover the topic nutrition care process. However, to be precise, dietary data is one of the steps of nutritional assessment, and it is going to gather data regarding what that person has been consuming. Once we have successfully done the nutritional assessment, this gathered information is going to help us in making a diagnosis. That what diagnosis I am giving to this person or individual who has approached me to seek guidance regarding nutritional status or state of nourishment. Diagnostic statement is extremely important so that we can further work on what kind of solution or what kind of help we need to provide to that individual. Diagnostic statement or nutritional diagnosis is generally based on 3 components: problem, etiology, sign and symptom. Problem is going to indicate that what is actually disturbing the person or the professional that we have discussed, what is the cause to that problem, and what signs and symptoms have actually provided evidence for this particular problem. We'll try to understand it with the help of an example. Excessive energy intake related to frequent excessive consumption of high calorie meals and snacks, as evidenced by daily caloric intake exceeding estimated needs by 750 kilocalories and 16 ALS weight gain in past 3 months. So if I split my diagnostic statement into 3 components, the first thing was the problem, which was excessive energy intake. Why was this happening? What was the etiology behind it? Because there was a consumption of high calorie meals and a lot of snacking. What was the point that provided you evidence? The evidence is that they are taking an energy intake exceeding 750 kilocalories and they have gained weight, 16 ALS to be specific, in the past 3 months. So this is an example of a diagnostic statement that once a nutrition care professional in nutrition care process has done thorough assessment, is going to present a diagnostic statement, which is generally based on these 3 parts: problem, etiology, sign, and symptom. Such statements are generally known as PES statements. The third and the next step of nutrition care process is nutritional intervention or nutrition intervention. Intervention has come out of the word intervene, by which we mean that we need to now interfere into the problem that we have just diagnosed. So we made a thorough assessment, then we diagnosed the problem, and now we are going to solve this problem to our best potential. And intervention is going to comprise of 2 steps: planning and implementation. First, you're going to plan that how am I going to assist the person? For example, if it was iron deficiency anemia, what am I going to do? Whether it is going to be a diet plan, whether it is going to be nutritional supplementation, or it is going to be something else. And then I'm going to implement that plan. If I'm going to offer a diet plan rich in iron sources, rich food sources, I have to plan it first. So intervention is all about intervening, about interfering in the problem and solving it. It is comprised of 2 steps: planning and implementation. Once I have given the intervention plan to the patient or client who has approached a nutrition care professional, it is mandatory to follow it up, to check that whether my plan is effective or not, whether the person is following it or not, whether we are able to achieve the measurable goals or not. That is basically known as monitoring and evaluation, that I'm monitoring my plan. And once I have completed the time period that we decided that we're going to follow, of course, the person is going to indicate that I would keep up with the nutrition care professional for like 2 months or 6 months, according to their feasibility and on the nature of the problem. Once we have done monitoring, we need to finish it up on evaluation, on authentic evaluation. For example, if it was a case of iron deficiency anemia, we need to evaluate it. That was some improvement seen in the hemoglobin levels of the person or not, whether we were able to correct the iron deficiency anemia or not, whether there was a slight improvement, whether it further deteriorated the condition, or maybe it had slight improvement or it had a major improvement. We have to evaluate it. So this was a brief overview of what nutrition care process is. I would like to quickly summarize my lecture that in nutrition care process, we have 4 steps: nutritional assessment, nutritional diagnosis, nutritional intervention, nutritional monitoring and evaluation. The nutritional assessment has 4 steps: anthropometry, biochemical evaluation, clinical examination, and dietary data. Diagnostic statements are based on PES, problem, etiology, and sign and symptom. Nutritional intervention has major 2 steps: planning and implementation, and monitoring and evaluation ensures that whatever you have provided as a nutritional intervention, whether that has worked for the patient or the client or not. This was all about nutrition care process. Thank you very much.